Hi, good day everyone, and my name is Caitlin Paslan, and I'm going to discuss about the blood for anaphysio chapter 11. So first is the blood. So what is blood? Blood brings oxygen and nutrients to all the parts of the body so they can keep working. Blood carries carbon dioxide and other waste materials to the lungs, kidneys, and digestive system to be removed from the body. Blood also fights infections and carries hormones around the body. Blood is made up of liquid and solid. So, the liquid part is called plasma. It's made of water, salts, and protein. So, over half of our blood is plasma. So, the solid part of your blood contains red blood cells, white blood cells, and platelets. So, the red blood cells, or the RBC, deliver oxygen from your lungs to your tissues and organ. So, next is function of the blood. So blood has many different functions, including the transporting oxygen and nutrients to the lungs and tissues. So forming blood clots to prevent exists blood loss, carrying cells and antibodies that fight infections, and not just for that, but they take also away tissue waste, and the lymph vessels carry lymphatic fluid. Next is the arteries and veins carry blood all over the body. They send oxygen and nutrients to the body tissues. So, arteries in red are the blood vessels that deliver blood to the body. Veins in blue are the blood vessels that return blood to the heart. So, arteries and veins are also called a blood vessel. So, the difference between them are tube of muscles that your flows through. So, the arteries carry blood away from the heart to the rest of the body. So, veins push blood back to your heart, and you have a complex system of connecting veins and arteries throughout the body. So, next is the composition of the blood. So, there are the main components. So, first is the plasma. The platelets are the thrombocytes, the erythrocytes, or the red blood cells, which is the RBC. And the last one is the leukocytes, which is the white blood cells. So, next is the plasma. Plasma is the largest part of your blood when separated from the rest of the blood. Plasma is a light yellow liquid. Plasma carries water, salts, and enzymes. The main role of plasma is to take nutrients, hormones, and proteins to the parts of the body that need it. So, cells also put their waste products into the plasma. So, blood plasma is a yellowish liquid. So as you can see in the picture, the yellow one is one of the plasma. So it is the components of blood that is freed from blood cells but holds proteins and other constituents of whole blood suspension. So it makes up about, I think, 55% of the body of the body total blood volume. So it is the intravascular part of intracellular fluid. So next is the platelets, or thrombocytes. It is a small or colorless cell fragments in our blood that form clots and stop or prevent bleeding. Platelets are made in our bone marrow, that sponge-like tissue inside our bones. Bone marrow contains stem cells that develop into red blood cells, white blood cells, and platelets. So, thrombocytes are pieces of very large cells in the bone marrow called megakaryocytes, and they help from blood clots to slow or to stop bleeding and to help wounds heals. And having too many or too few thrombocytes or having platelets that don't work as they should can cause problems. So next is the red blood cells, also referred to as red cells, red blood corpuscles, hematids, erythroids cells or erythrocytes are the most common type of blood cell and the vertebrate's principal means of delivering oxygen to the body tissues via blood flow through the circulatory system. So, as I said earlier, the blood cells carry oxygen from our lungs to the rest of our body. So, then they make the return trip taking carbon dioxide back to our lungs to be exhaled. So next is the white blood cells. It is a part of the body's immune system. They help the body fight infection and other diseases. So leukocytes are a white blood cells count detect hidden infections within your body and alert doctors to undiagnosed medical conditions. So, such as autoimmune disease, immune deficiencies, and blood disorders. So, this test also help the doctors monitor the effectiveness of chemotherapy or radiation treatment in people with cancer. So, next is the form elements. The form elements are cells and cell fragments suspended in the plasma. So the three classes of form elements are the erythrocytes, red blood cells, leukocytes, white blood cells, and the thrombocytes or the platelets. So the form elements are those of the components of the blood, and it is the cells and cell fragments suspended in the plasma. So which is the RBC or the red blood cells, which is the erythrocytes, the leukocytes, which is the white blood cells, and the thrombocytes, which is the platelets. Next is the preventing loss. So, tranexamic acid is a medication used to treat or prevent excessive blood loss from major trauma, postpartum bleeding, surgery, tooth removal, nosebleeds, and heavy menstruation. It is taken either orally or injection into a vein. Side effects are rare. So if someone bleeding, apply direct pressure to the wound. So protect yourself by wearing disposal gloves if you can and covering any wounds on your hands. Use a pad such as a clean cloth, t-shirt, or a bandage to apply pressure to the wound. So if you don't have anything absorbent, just use your fingers. So next is this one. So an injection of tranexamic acid should be given as soon as possible to help reduce the bleeding. Tranexamic acid works by preventing the body from breaking down blood clots too soon, so which allows the clots to help stop the bleeding. So tranexamic acid is a medicine that controls bleeding. So it helps your blood to clot and is used to nosebleeds and heavy periods. Or any other cases of bleeding. And using tranexamic acid can help stop bleeding. So next is the blood grouping. So there are four main groups, blood groups. Type of blood or AB, and O. Your blood group is determined by the genes of inherit from your parents. Each group can be either Rhd positive or Rhd negative, which means in total there are 8 blood groups. So blood typing is used to determine an individual blood group to establish whether a person is blood group A, B, AB, or O, and whether he or she is Rh positive or Rh negative. So, what is Rh positive and Rh negative? So, here we go. It is a rhesus or Rh factor is an inherited protein found on the surface or red blood cells. If your blood has the protein, you are Rh positive. If your blood lacks the protein, you are Rh negative. Rh positive is the most common blood type. So each person has two Rh factors in their genetics, one from each parent. So the only way for someone to have a negative blood type is for both parents to have at least one negative factor. So for example, if someone Rh factors are both positive, it is not possible for his or her child to have a negative blood type. So the next is the diagnostic blood. So the diagnostic blood test is a lab test, and diagnostic procedures are tests used to check if a person's health is normal. So, for example, a lab can test or a laboratory can test a sample of your blood, urine, or body tissue to see if something is wrong. A diagnostic test like blood pressure testing can show you have a low or a high blood pressure. So next is diagnostic tests are either invasive and non-invasive. Invasive diagnostic testing involves puncturing the skin or entering the body. Examples are taking a blood sample, biopsies, and colonoscopies. And non-invasive diagnostic testing does not involve making a break in the skin. So diagnostics test can consist of physical examination and biopsies to pregnancy test and cancer screening. So, diagnostic testing is defined as any approach used to collect information in order to make an informed clinical decision about a patient. So, next is the non-alcoholic fatty liver disease, or the NAFLD, is the most common chronic liver disease in the United States and many other parts of the world. Its prevalence continues to rise, currently affecting 20 to 30% of adults and 10% of children in the United States. So, although currently a combination of non-invasive clinically available laboratory and imaging tests may help in the diagnostic evaluation of a patient with suspected non-alcoholic fatty liver disease, or NAFLD. A liver biopsy remains the only reliable way to precisely diagnose NASH and establish the severity of liver injury and presence of fibrosis. So that's all. Thank you.